We are the group of professors who wrote this paper, Dr. Herrmann and Dr. Souza Jr. I'm Dr. Mengatto.
This review aims to provide an overview into bruxism cosmetic rehabilitation and how this can be implemented with good outcomes for the patient.
Bruxism is a parafunctional activity related to clenching or grinding the teeth, and the main consequence of grinding the teeth is tooth wear, which may cause deleterious effects on patients' masticatory function, aesthetics, and quality of life.
We are here at the Dental Learning Hospital of the Federal University of Rio Grande do Sul in Brazil, and what we daily face in the dental clinics are people with sleep bruxism. The discussions about sleep bruxism etiology and treatment gained widespread attention in the last decade and have changed some paradigms about sleep bruxism held by clinicians.
Sleep bruxism etiology is a complex physiological process which involves different functional pathways related to sleep, response to stress, brain activity, muscle activity, cardiac function, and breathing.
In adults, recent findings reported in the literature suggest that there is a relationship between intraesophageal acidity, gastroesophageal reflux disease, and sleep bruxism occurrence.
The management of severe tooth wear due to sleep bruxism is a challenging situation because of the common reduced amount of remaining dental structure and loss of vertical dimension of occlusion. Restorative approach of bruxism-related patients, especially with severe tooth wear, is a complex subject. We have some materials options to restore those teeth, such as composites, ceramic, and cast metal restorations. However, there is a lack of scientific information about the performance and survival of these restorations in a long time.
We would like to share with the readers some literature-based concepts about cosmetically rehabilitation of tooth wear in sleep bruxism patients. So we hope you enjoy this paper and find it useful for your daily-based clinics.